And he was just a little guy. His love of pasta never ended. It was his first day.
Kathy Moreland lost her son Austin 3 years ago this week.
Like many teenagers, he wanted to belong.
They lip sync it.
Moreland says Austin struggled with anxiety and mental health issues. By his mid-teens, he was experimenting with alcohol, pot, and later meth.
He tried to become sober a number of times.
But his mother had a tough time getting him into a suitable treatment program. In June 2020, after celebrating his graduation, Austin died of fentanyl poisoning. He was 18 years old.
Austin, in spite of his struggles, could have been a very productive worker and member of society. And we've lost that.
An average of 20 Canadians are dying each day from opioid poisonings. The latest numbers for 2022 also showed 14 daily hospitalizations. A new report from an Ontario research team suggests teens and young adults are among the hardest hit.
Rates of opioid toxicities in younger people have been climbing.
Researcher Tara Gomes found rates of opioid-related deaths among Ontario teens and young adults under 25 tripled between 2014 and 2021, while treatment rates for opioid addiction during the same period dropped. Her team also found only about half of those who died had a diagnosis of opioid use disorder, while the other half likely were not regular drug users.
For people who are occasionally or irregularly using drugs, if they're accessing a really unpredictable supply, it can be incredibly dangerous.
So this here is naloxone. So this is a drug that can reverse an opioid poisoning.
This Toronto harm reduction worker says tools like these can keep drug users safer, including test strips sold online that check for fentanyl. But he says the onus is also on governments and healthcare teams to get more young people access to treatment when they need it.
It's because the wait lists are so long that if they're not attending, they're likely dying.
Like Austin.
So, Lauren, that can't possibly be the end of it. Where is the fix here?
Well, there's no quick or simple answer to this, and we know our healthcare system is already struggling in so many different ways. But what we kept hearing from the people we spoke to is we need to fix this on multiple fronts. We need to get more access to harm reduction sites, we need to have more treatment centers for young people, and we need to have more mental health supports to get those wait times down so people can address the issues that might make them turn to drugs in the first place. And if we don't, we're going to see more deaths.
Real warning. All right, Lauren Pelly, thank you.
Thank you.